Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. We have already uploaded more than 3,500 videos on YouTube. And those who want to see our previous video, you just click on IFPH Homeopathy at YouTube. Let me come to today's guest. As you all know, today our guest is Dr. NIPUN SINGH DABI. Doctor has completed MD and is a PhD scholar and is working as assistant professor at Rajkot Homeopathic Medical College, Pearl University, Gujarat, and is the director of DABI Homeopathy, DABI Consultancy Private Limited. And last time, Doctor talked about a very important subject, that is managing lifestyle disorders through homeopathy, contemporary clinical perspective. Today, Doctor will talk about the second part of the same, because last time we have no time to finish it, and so Doctor will be coming over here and share some of his experiences in managing lifestyle diseases. So we proudly welcome Dr. NIPUN Singh Dabi. Welcome. Can you adjust your camera a little more?
Okay, sir, I am audible?
Yes, you are audible and visible.
Thank you, sir. Good evening, everyone, for giving me the second opportunity to speak on this topic. The topic is managing lifestyle disorder through homeopathy, contemporary clinical practice. Before proceeding, let's revise what we have learned in the previous section. The topic is about lifestyle disorders and what are they? Basically, they are non-communicable disease arising from the unhealthy lifestyle choices caused by factors such as poor diet, physical inactivity, smoking, alcohol use, and chronic stress. Those conditions include cardiovascular disease, type 2 diabetes, obesity, hypertension, certain cancers, and chronic respiratory diseases. Basically, these disorders are generally caused by our daily routine in which we follow the unhealthy lifestyle. This whole disorder, lifestyle disorder, or we can say non-communicable disease, are on the rise. As we have seen in the global burden of disease, they were in the increasing factor. These diseases develop gradually due to long-term exposure to unhealthy habits, not caused by infectious agents, and is strongly associated with behavioral and environmental risk factors that we follow in our daily life, in daily routine. These diseases are generally preventable, but what we can say, the patient does not always follow a good habits. So they develop through lifestyle modification and can be controlled through diet, exercise, stress management, and removing tobacco and alcohol from our daily routines. Basically, they are classified under 8 categories. They are metabolic disorder, cardiovascular disorder, endocrine disorder, respiratory disorders, cancer, mental health disorders, musculoskeletal disorders, and others. Under these categories, subcategories, for the metabolic disorders, we have metabolic syndrome that is characterized by obesity, type 2 diabetes, metabolic syndrome itself, which include NIPUN and dyslipidemia. The other is cardiovascular disorder, which includes hypertension, coronary artery disease, stroke, atherosclerosis. For endocrine disorders, generally thyroid dysfunction and PCOS, which itself is a part of metabolic syndrome, is included. In the other categories, respiratory disorders such as COPD and asthma, which are on the rise due to a certain factor, that is air pollution. This is the top most fourth category in the top risk factor. For these are the cancer which are the wrong headings. They are lung cancer, colorectal cancer, breast cancer, prostate cancer, and liver cancers. And for the mental health disorders, we have depression, anxiety, and stress-related disorders. The musculoskeletal disorders generally affect the elderly people and they are osteoarthritis and osteoporosis, which is prevalent in the women age after 45. The others are chronic liver disease, kidney disease, and irritable bowel syndromes. That is a psychological and physiological function of the GI system. There is disturbance in that. These are the top risk factors that was proposed by the Global Burden of Disease. You can see they all are the risk factor which goes on to develop the metabolic syndromes and which then affects the population. The first one is high systolic blood pressure, high fasting plasma glucose, high body mass index, smoking, and the new factor ambient particulate matter pollution. All the 5 factors are silent, they are hidden, and generally strike people in the young age group. It will maybe 13, 14, or 20 years, and the disease they produce are generally developing after 40 years of age, 40, 50, such as diabetes, hypertension, atherosclerosis, or MI cases. MI cases which are now on the rise, you can see. This is basically the level of risk factors. Level 1 includes behavioral risk, metabolic risk, and environmental and occupational risk. Level 2 includes high blood pressure, air pollution, smoking, high BMI, high blood sugar. And level 3 and 4 are generally risk factors, but they are more specifics for causing the disease. In the air pollution, that is PM 2.5 factor is more important. Now, what causes this disease? What underlies the hypothesis that underlies this disorder is insulin resistance and metabolic syndrome. Insulin resistance is the basic factor which produces all type of disease. The insulin resistance is generally caused due to obesity. That is often associated with obesity. Obesity in adipocyte cells secretes mostly leptin hormones which resist the function of insulin and produces diabetes, pre-diabetes, that is impaired condition, and these are the hypertension, dyslipidemia, and non-alcoholic fatty liver disease and PCOS in women. So basically, these are the components of metabolic syndromes, and the trigger factor is insulin resistance, which is associated with obesity. We are going to take this one by one disease, the most 5 important diseases. The first is diabetes mellitus. As we all know, how this is called, there are 2 variants, type 1 and type 2. General type 1 is an autoimmune variant and affects young population, basically due to trigger factor due to autoimmune condition or any infection, alcohol, obesity, anything can be occurred in due to the trigger factor. For the type 2 diabetes, the trigger factor occurs in the young age at 20, but the disease gradually comes into diagnosis at the age of 40 years when the patient comes to the OPD with complaints such as polyuria, polyphagia, polydipsia, and obesities. These are the diagnostic factors. The now prevalent is the HbA1c. If its level is more than 6.4%, 5.7 to 6.4%, it indicates the patient is in the pre-diabetic stage. This condition, it means the disease is not fully developed. We can either reverse the patient to the normal, or if he doesn't follow a good diet, it may go on to develop the diabetic condition, full-on diabetes. So basically, we have to tackle this stage. This is the category for criteria for hypertension. Hypertension is also the disease involved in lifestyle disorder. These are the basic categories. Generally, we diagnose hypertension when the blood pressure level is above 140 and 90. As we age, the blood pressure increases, but in the recent studies, it has mentioned that those people who are suffering from hypertension as well as diabetes mellitus, the target blood pressure should be 130 by 80. So you can see, age-specific hypertension is different things, and disease-associated hypertension in which we have to follow a profile and changes, management changes. We have to take the blood pressure level below 130 and 80. In this hypertension, general risk factors, it is also 2 type 1 and type 2. The type 1 is mostly prevalent in 95% of the cases. But the causation is idiopathic or unknown. General risk factors are given such as age, high salt intake, heavy alcohol consumption, obesity, lack of exercise, stress, and poor sleep. So you can see The type 2 is generally caused by certain secondary factors in which disorder, endocrine disorder, thyroid disorder, cardiovascular disease. But the type 1, that is an essential hypertension, is generally due to these risk factors without any underlying cause. They may be or may not cause this disease. Hypertension in the conventional way is generally followed by regulated by a DASH diet. It is dietary associated reduced systolic hypertension. First line therapy, we have used diuretics, EC inhibitors, ARB, and calcium channel blockers. These are all the conventional medicine we use for the management of hypertension. For the lifestyle, we generally have to avoid the risk factors which may or may not cause the hypertension. The third category is of mental disorder, which is also in rise in the today's world due to alienation, use of mobile smartphone use, and the corporate lifestyles. The factors are depression, anxiety disorder, and stress-related disorder. Mostly patients are coming in the form of anxiety and depression, and they are more prevalent due to changes in circadian rhythm, changes in sleep, narcolepsy, insomnia, somnolence, night terror, nightmare, night dreams. They are all the features of depression. In the anxiety, patient generally present with restlessness, muscle tension, stiffness, impairment in and significant distress, sometimes complaint of fear. These are the features of anxiety disorder. The management plan for the conventional type is from psychotherapy, that is cognitive behavioral therapy, mindfulness, and interpersonal therapy. For the lifestyle and behavioral intervention, we have sleep, hygiene, exercise, stress management, and social support. The other one is pharmacological and conventional. If the patient is not regulated by other top two, then we have to go by SSRI, that is serotonin uptake inhibitors, fluoxetine, sertraline, and certain benzodiazepines we can give. The other is fourth condition is dyslipidemia. Dyslipidemia, we can say obesity or impaired cholesterol, triglyceride, or HDL level in our body. Under this, there are four categories of total cholesterol: LDL, HDL, and triglyceride. The HDL is considered as good cholesterol, and all others are bad cholesterol. Total cholesterol is the combination of all the level. Generally, the range is below 200 mg for total cholesterol. For LDL, it is between 100 and 129. For HDL, the level is 40 to 60. Generally, we tell our patient to maintain the level above 60 mg/dl. And for triglyceride, the level should be below 160. Dyslipidemia, also like hypertension, generally develops from the young age due to use of Western diet, fast foods, soft drinks. The others associated with dyslipidemia is obesity. Basically, dyslipidemia is altered or disturbance in the triglyceride levels. Obesity is generally characterized by BMI and waist circumference. You can see the BMI was the older nomenclature for diagnosis of the obesity. Now, in the new terms, we use waist circumference. It basically tells the patient is generally overweight, normal, obese class 1, class 2, and class 3, which indicates the severe risk they may develop for the diseases such as CVS and myocardial infarction. These are the conditions. The other fifth one is the MASLD, which completes our metabolic syndrome. MASLD which was previously known as NFLD, non-alcoholic fatty liver disease. Its name is changed in 2023 to MASLD, which is generally suitable for metabolic associated steatotic liver disease. It includes metabolic syndrome. There are five categories, criteria under which we diagnose MASLD. At least one should be present. One is anthropometric measurement, which you can see from the BMI or waist circumference. Other one is the glucose, fasting, HbA1c or postprandial. The third one is the blood pressure. Fourth one is the triglyceride. Fifth is the HDL cholesterol. And in the minor criteria, if patient is taking lipid lowering treatment. So you can see these are all five diseases, and these are the top 5 risk factors which are causing these disorders. The management of diabetes, generally measured by lifestyle modification and pharmacotherapy. We don't have to discuss this. The dyslipidemia, the mostly measured maintained through vegetarian or DASH diet. We have to reduce saturated and trans fat. Generally, we prescribe patient for aerobic exercise, weight control, and smoking cessation. For the conventional medicine, patient take statins, bempedoic acids, or certain lipid-lowering treatments. These are the American Health Association guidelines for the lowering of lower level of LDL, HDL. Basically, what this session tells about the development of disease. This lifestyle disorder do not develop suddenly. They are developed slowly, silently, and over the years. As I have told you, the first effect takes place in the young age, that is teenage years, or the age of 20, 25, 30. And the disease goes on to develop at the age of 40, 50. The triggers begin in youth, such as poor diet, inactivity, stress, smoking, and alcohol. Metabolic changes start early but remain unnoticed. The disease is generally developing silently, and the clinical disease appears later in adulthood with its complications. The complications arise after prolonged exposure to unhealthy habits and certain and continuous use of medicine for controlling them. You can see from this image that the trigger factor which patient or the population follow are this. They are the triggers. The disease is progressing silently with insulin resistance, fatty liver, dyslipidemia, and elevated systolic hypertension. The disease onset may present with type 2 diabetes, MASLD, that is metabolic associated stenotic liver disease, or MASH, metabolic associated steatohepatitis. The complications are in the form of CKD, CVS, and atherosclerosis. This is the slow progression from early habits to serious health complications. So, generally, as their name suggests, that are the lifestyle disorders, and they develop due to inappropriate lifestyle. The MSLD develops silently due to metabolic dysfunction, goes on to dyslipidemia. Dyslipidemia leads to atherosclerosis, and which eventually for the myocardial infarction or heart attack. Type 2 diabetes develops due to insulin resistance in peripheral tissue. This insulin resistance causes increased glucose in the blood, which stimulates beta cells to produce more insulin. Then this condition causes hyperinsulinemia. All this results in for the 10 to 20 years for beta cell exhaustion. As the beta cell completely exhausts, the patient goes on to develop the type 2 diabetes mellitus. So, for these disorders, what is the homeopathic perspective? What medicine can be prescribed to a patient when it comes to our clinic? Mostly these disorders, generally patient comes with the symptoms or abnormal reports without any changes in their lifestyle, any problems. Generally patient complains of polyuria, polyphagia, weakness, lethargy, fatigue. Not any more important these symptoms which can delimit patient for working his job or during his job. These are our homeopathic medicines which generally we prescribe for our patient in these disorders. For the type 2 diabetes mellitus, the Ayush Mantralayah has given this medicine. It is Thallium jambolinum, Gymnema sylvestre, uranium nitricum, and phosphoric acid. For the obesity, these all are the constitutional remedies such as calcium, lycopodium, and these four are the organ-specific or adjuvant remedies, which we are going to discuss later on. The other is hypertension and high systolic blood pressure, in which we generally prescribe paracetamol, Lunine, Dolphia, Belladonna, and Naxmoica. For the dyslipidemia, these are the constitutional remedy like lycopodium, Oromet, or any other we can prescribe. And these four are the organ-specific medicine, such as Allium sativum, Cholesterinum, Terminally Arjuna, which has been proven in the research, and Coteria gumeri, on which clinical researches are going on and giving very good results. The other is the metabolic syndrome cluster, that is generally a combination of all this and generally treated through constitutional medicines with certain organ-specific remedy you can prescribe under them. For the endocrine disorders, we have netromure, thyroidinum, lycopodium. For respiratory disturbances, we have arsenic album, antiprad, and plata orientalis. Certain cancers, for this, they are lung, colorectal, breast, prostate, and liver cancer. At this stage, colorectal cancers are on the rise along with lung cancer. For the lung cancer, the trigger factor is air pollution, and the colorectal cancer is generally due to improper dietary factors in the form of ulcerative colitis or Crohn's disease, which goes on to develop rectal carcinoma. So basically, for this, we have medicines such as carcinolism, puja, occidentalis, conium, and phytolecum. For the mental health category, we have mental remedies such as ignatia, netromure, or metallicum, telephos, or phosphorus. This generally induce good sleep, reduce stresses, and emotional imbalance. For the musculoskeletal part, we have Rastox, Bryonia, Calcria Phos, Symphytum, and Arnica montina. And certain diseases such as CKD, that is also on the rise due to effect of diabetes mellitus, proteinuria, and NAMSH. We have Cardus mellitus, Barbaris vulgaris, Calcaria sulf, Ceratonium majus, hydrangea. These are the medicines which we generally give in this category. This is a miasmatic affection of this disorder. As I've already told you, the disease generally runs silently until they are diagnosed accidentally. And for that time, the patient has been suffering from this disease and has developed certain complications or certain factors which are now irreversible in nature. In case of diabetes, in case of anhydrity or liver cirrhosis, in case of MI or atherosclerosis, which can be reduced, but if the patient has been under MI, then generally it has a DALY, disease-associated lifestyle loss. Basically, we have the miasm. Generally, syphilitic miasm underlines the latent disease or silent diseases. The psychosis miasm generally underlines sexual organs, pelvic disorders, and obesity category in the form of PCOS, dyslipidemia, and certain cysts in the liver or anhydrity. Psoric manifestation generally affect the mental disorders, or in the mental category it is more prevalent. You can see the three classification. The SORA generally affect function or basically develops functional disturbance that are related to surface manifestation. The syphilitic stigma is generally ulcerative, affects brain, that is in the form of cerebrovascular accident that are stroke or hemorrhage, in the form of larynx, throat, in the cases of throat cancer, lung cancer, in the eyes, in the form of retinopathy, and bones and periosteum in the form of osteoporosis or osteoarthritis or osteomyelitis. The psychosis, we have infiltration and deposits, and these are developed through infiltration, abscesses, hypertrophic, and cyst in the PCOS, liver cyst. These are the disorders generally gives due to psychosis manifestation. And our session generally focuses on the adjuvant remedies prescribed along with our constitutional remedies. These are our adjuvant remedies we generally prescribe, such as Thamele Arjuna, Sidajam Jacolarum, Acid Phos, and Goteria goveri. When the patient comes to a clinic, what problems do we face in this lifestyle disorder? Generally, in the case of lifestyle disorders, if a patient comes, everything is normal, patient is going and his lifestyle is smoothly, but he's generally went under a routine investigation and came with increased lipid profile. We ask patient, what is his problem? I am just fine, nothing but just my report has shown some abnormality. So what should we do? And what should I do? Others, in the case of hypertension, it is diagnosed accidentally, but the patient is following a normal lifestyle. He says, I am doing aerobic exercise, I am doing yoga, yet I have diagnosed with hypertension. Patient comes with obesity and increasing weight, yet its lipid profile is normal. Patient who obese has weight gain, is gaining weight, but his profile is normal. So what should we do in this case? Also, in certain risk factors, patient is suffering from risk factors, but there are no abnormal lab investigation. We can look into the patient. We can see that he is undergoing through disturbed lifestyle factors and routines, but patient say I am fine, and if you see my reports, they are also normal. So I do not have any problem, no complaint. Also, in certain cases of dyslipidemia, we have seen the patient is lean thin, yet the profile show abnormality. In certain organ-specific cases or constitutional or paradoxical cases, we need to choose between constitutional medicine and organ-specific medicine. And certain, or in today's world, generally patient goes for short-term approach in the form of Ozempic or statins, which are lipid lowering or weight loss remedies, which are generally on the rise. So if patient can come to us, or say if we say out to the patient that you are generally fine, you have to follow the lifestyle, exercise and weight gain, but he would say that I am not going to choose that, and I am going for the alternative or the new modern medicines such as Ozempic or statins. So what should we do in this case? How do we handle our patients in our OPD? So these are the systemic approach we should follow. Basically, first in the clinical scenario, when the patient is going to normal lifestyle but has abnormal lipid profile, so we have to follow the case of anamnesis. We have to take proper case taking and look at the latent susceptibility in the form of familial positive history, and give some constitutional imbalance or constitutional medicines. In the case of accidental diagnosis of hypertension, despite normal lifestyle, we have to look for hidden miasmatic predisposition or stress reactivity. In case of obesity with normal investigation, we have to look for functional imbalance, psoriatic manifestation, which have not been developed into pathologies. In case of no risk factors or abnormal labs, we have to look for genetic predisposition, psychotic accumulation, or suppressed discharges. In the case of lean patient with a normal lipid profile, constitutional weakness, metabolic dysregulation, which are not lifestyle driven, should be looked at. What the homeopathic reasoning says in this type of cases, that how should we choose? Should we choose constitutional medicine or should we choose organ-specific remedies? For the constitutional medicine, if the patient shows totality of symptoms, if patient gives certain underlying disorder with mental, emotional and physical traits, and this points to all deep miasmatic roots, we have to go for constitutional medicine, such as calcareous carb in the case of obesity, sulfur for adensora, and lycopodium for lean patient liver dysfunction. But what we see in the constitutional medicine, we can generally prescribe them with high potency, and they cannot be frequently repeated. So for that, we have to give the organ-specific or rare remedies. They should be given when there is a clear organ pathology and abnormal lab findings. So if the patient choose such as Ozempic and statins, we have their alternatives in the form of terminally Arjuna, Botaria gomeri, Cholesterinum, Zygium lebulinum, and Cartacus. They are the supportive remedies should be given until the constitutional remedy addresses the deeper susceptibility. So this is the homeopathic reasoning for undertaking or tackling this type of cases. The logical framework is generally the same. It involves anamnesis, that is clear-cut case taking and deep case taking, miasmatic analysis, remedy selection, integration with conventional and integrative medicines, and monitoring through lab investigation and clinical outcomes. Now, the arguments patient generally choose, why the patient chooses the conventional medicine. Patient often chooses conventional drugs because lab values are abnormal even when lifestyle is normal. So, patient go for the short-term management. Our answer in this case is the lab abnormality does not cause disease alone. It reflects susceptibility which may go on to develop your disease. Other is constitutional remedy addresses the root imbalance. Till that time, we have to prescribe adjuvant remedies that support the organ until deeper correction occurs. This dual approach is now form the basic backbone of our clinical practice and should focus on our clinical practice. We should prescribe certain or majorly adjuvant remedies frequently to give the patient physical and moral and psychological support. Also, to adhere to the therapy. There are certain cases I am going to discuss here. The first case is of a 36-year-old unmarried female professor who is presented with obesity. We generally we did the general examination. Her weight came 70 kilo. Her height was 5 feet. The BMI came 30.2 kilogram per meter square, which is in the range of overweight or going towards the obesity. Patient generally reported a desire for sweet, had regular menstrual cycles with no abnormalities, and maintained a routine of evening walks along with a well-balanced diet. So here you can see the patient is following a well-regulated lifestyle, yet he is comes to the clinic complain of obesity. So patient is saying that I am doing everything, yet I am suffering from the obesity. I am not losing weight despite following the evening walks, doing well-balanced diet. So in this case, we advise for the liver function test, lipid profile, and they all came raised and abnormal. The diagnosis generally after looking at this disorder, the lab reports, we find the total lipid profile were raised, and her ALT and AST and GGT, they are the liver function tests or liver enzymes, they all were raised. So you can see in this report. So the diagnosis was made of the obesity with metabolic dysfunction, and patient has the raised LFT. So we thought of the diagnosis of MASLD, that is metabolic dysfunction associated with liver disease. Now, what should we do in this case? In this case, we basically prescribe the Terminalia Arjuna 6CH 280 for 28 days. Terminalia is very good medicine for hypertension, disturbance in platelet disorder, elevated lipid layers, lipid profile, and liver enzymes, and it acts wonders. With this, we gave her some dietary modification and in the form of exercise. After a 3 to 4 months treatment, the reports came normal. Her lipid profile as well as the enzymes were now come under the normal range. So you can look here, they all are below, and the good cholesterol was also raised. Generally, we advise about 60, but in this case, it was 54.10. So you see how, with the help of only an adjuvant remedies, we tackle this case and we treated our patient. Now, this is another case. This is the case of diabetes mellitus. The patient, 47-year-old male, presented with polyuria. On evaluation, was found to have an incidental diagnosis of diabetes mellitus. He generally gave the symptoms of polyuria. When we asked, he has a positive family history of diabetes. His father was suffering from the disease. On asking about his lifestyle, he said he is a corporate employee, generally has a hectic lifestyle, and with inappropriate diet pattern due to work commitments. Sometimes he has to eat outside his home and generally prefer the fast food. So this was his presenting complaint. We asked for other complaints, but patient gave no other problems. Just this diagnosis, which was an accidental or incidental diagnosis. We advised patient for the HbA1c, and it came raised. It was 6.6 and 142.7. The level was came. So what did we do? We gave acid phosphoricum, and Aploma augusta mother tincture Q for 28 days, which we followed for the next month and next month. Generally, in this case, the SB1C is done after 3 months hiatus, every 3 months, because it generally gives the average and likely hemoglobin concentration. So after 3 months and with proper exercise and diet, his force was reduced to 5.4. Post treatment, the SB1C was reduced to 5.5 and it was normally under control. So in this stage, we were able to control the patient due to certain lifestyle and medication. But let's say the patient said, I am not going to follow and my report is now normal, I don't have to take the medicine. And yet you know that diabetes is an irreversible condition. Generally, we have to follow lifestyle, dietary and medication. So if the patient doesn't take, then he may go on to develop diabetic complication and raise level, which we see in this third case. In this case, the patient was a female patient. She came to us with the problem of she was suffering from grief and sadness and loss of a mother, increased frequency of urination, numbness over the whole body, fatigue, lethargy, and generalized swelling was the main complaint of the patient. She has been consulting independently but consistently preferred homeopathic treatment whenever she sought care. Initially, the patient was on conventional medicine for diabetes, but after consultation with endocrinologist, we advised a gradual tapering rather than stopping abruptly. First, we advised SB1C. Here you can see the patient was with us since 2020. And she was on and off. Initially, she came with SB1C 7.9%. It was a high level. Generally, raising about 7 is the diabetes is not under control. So she was taking the conventional medicine, and we also told her to be on the conventional medicine along with our adjuvant remedies, that is acid force and zezathepurine. For 3 months, we prescribed these medicines. Patient kept on the conventional along with conventional medicine and our medicine. After 4 months, 2021, 4 months, there were no new symptoms. The presenting problems were a little bit reduced. The SB1C was also reduced. So, and the patient was not adhering to his therapy. She was on and off, not taking conventional very regularly. So we have prescribed the same prescription continuous repeatedly. We told her to take our medicine regularly. After 3 months, we again go for the SB1C. Now the SB1C level is reduced. So we told her that our medicine and frequency should be reduced, and we changed the potency, potency from Q to 6x. As now we are going from organic specific to generally productized form. Now you can see from 2021, patient was maybe normal, not normal. She again came to us with a raised level of 6.7%. We again gave her the same medicine. After 6 months, her level was reduced to 6.0. After 1 year hiatus, she again came to us with the raised level of 6.7% and the mean blood sugar level 145.59. We again prescribed her the same medicine, and after 9 months, she was on our medicine. Now she is continuously taking our medicine, and her SB1C is the normal range. Not normal mean generally the impaired level, but it is in the control range. Patient is not suffering from any problem, no edema, no swelling, no frequency of polyuria, no constipation. Her grief has been subsided. There is no mental problem. You can look at the report. That is the initial report, the 7.9, 6.9, 5.8, 6.0, 6.7, 6.7, 6.39. In this stage, now this is the recent report of the 2026. So, of all the three cases, they are of the organ specific. We didn't prescribe any constitutional medicine. So, why do we choose the adjuvant remedies? First, the constitutional remedies cannot be repeated frequently in high potency without risking aggravation. If we give them, we cannot repeat them, and if we repeat them, they generally came with the aggravation. Second, the organ-specific remedies act as a functional support between constitutional uses. Third, patient may be clinically stable but show abnormal lab reports. So in this case, patient generally coming with the abnormal lab reports. You look at the patient, you ask for complaints, he or she doesn't give anything, you just have the reports. So what do? Maybe a single dose of constitutional medicine and follow up with the adjuvant remedies. The targeted organ remedies help regulate specific systems such as terminal arjuna, which has a very good role on the blood pressure, CVS, GIT, and liver. For the cholesterol, it acts on the fat metabolism. Sidajan zambolena acts on the glucose metabolism, and Bacteria gomeri acts just like terminal arjuna on the lipid metabolism. So they are the specific remedies. Other is the parallel to modern medicine. What do we have? They have such drugs such as Ozempic, Statin for every remedies, for every disease. They prescribe them. Patient chooses them. Patient takes them. Patient suffer from the side effects that come to us, but generally, the patient chooses them. The gastric surgery and these drugs, Ozempics, are weight losing drugs, which we call them, are rampantly are on the rise. So, for parallel to modern medicine, what do we offer? This adjuvant remedies, which we have plethora in our medica. The other is safe bridging strategy, allows ongoing management without over reliance on constitutional medicines. So we generally don't have to increase or decrease the potency, decrease or increase the repetition. We can rely on our medicine, adjuvant remedies, and generally they give the good result and controlled result. Certain silent pathology need to be controlled by adjuvant remedies, and to prevent progression. If the patient come in the later stage, has taken various high potencies or been under various homeopathies, so for that we need to prescribe certain medicine and have lower potencies organisms. So here are our remedies and their symptoms and why do we use them. Basically, I have done the research on the terminal arjuna in my MD for the hypertension, and in my PhD I am comparing terminal arjuna and Bacteria gomeri. So I have given the cases of terminal arjuna and acid falls. Terminal arjuna basically use the treatment of cardiovascular disease. It affects heart disease and reduces chest pain. In the high blood pressure management, high cholesterol levels. So this all 4 points are the risk factor and trigger factor for the lifestyle disorder. So the terminal arjuna comes as the best medicine for the treatment of non-communicable disease. It has anti-ischemic activity, it has LDL oxidation, it protects against ischemic injury, it reduces atheromas, and supported by experimental and clinical evidence, I already told you in my MD research studies as well as certain Ayurvedic studies, it acted efficiently and very well. The other drug is Bacteria gomeri. In the conventional side, its active principle alpha-acerone is used. The rats, mice, and chicken. In our medica, we generally use the dried bark of the plant. It acts as a 2,4,5-trimethylloxy 1-propylbenzyne. It acts on the hepatic coenzyme reductase and reduces the LDL, VLDL, and triglyceride. Improves your good cholesterol HDL. In experimental models, it has been shown to reduce serum cholesterol levels in both rats and humans. In broiler chicken, it also has been shown in the STSH activities. It has very good pharmacological activities and reduces hypercholesterolemia. The other is cholesterol, which is generally prescribed in gallstone, pancreatitis, acute and chronic cases. But it is also a good medicine for metabolic associated cirrhotic liver disease and MASH and NFLD liver cirrhosis. It generally reduces hepatic engorgement, burning pains, jaundice, gallstones, opacities in your eyes, insomnias, and certain tumor growth in the form of lipoma, that is benign growth, are also reduced by cholesterol. It is the physiological component of lecithin, which we prescribe in anemia and weakness, and in our veterinary cases, as they generally prescribe in the animals. The other one is mucous vesiculosis, those who suffer from obesity along with thyroid imbalance. This medicine is generally prescribed for the treatment of obesity, corpulence, fatty livers, and sluggish thyroid. The clinical role is it stimulates metabolism, it reduces fat deposition, and supports NFLD and reduces dyslipidemia. The other one is Allium sativa, that is basically known as garlic. It also indicated in lowering of cholesterol, improves vascular health. If you are suffering from vasculitis or any other diseases, it is also shows certain beneficial effects. In case of GIT, it aids digestion and liver function. This can be tackled in the form of improper diet. Patient take patient diet or the trans fat, we need to give this medicine. Gymnema sylvestra is generally given by the Ayush Mantralaya or CCI studies. They are shown as a sugar destroyer. Indication are diabetes, sweet cravings, and metabolic syndromes. It reduces sugar absorption, improves glucose and lipid metabolism. The other drug is Viola odorata. It acts also known as sweet violet. It is also supportive in the case of obesity and metabolic imbalance. The Caesarian japonicum or jamun, we all know that it is in the form of diabetic mellitus, glycosuria, polyuria, and frequently prescribed remedies in the case of diabetes. Labroma augusta or Pulat Kambal, prescribed in the form in diabetes mellitus, diabetes insipidus, sleeplessness, or albuminuria. The Ossimum sanctum, that is Tulsi, we gave in the stress, mental disorders, diabetes, and cardiovascular risk. It has very good antioxidant, anti-diabetic properties. Now, these all were our homeopathic remedies, and because our topic is lifestyle disorder and metabolic disturbance, we need to incorporate certain good practices in our lifestyle. They may be in the form of exercises, physiotherapy, or yoga practices that is mostly implemented by Ayush Mantralaya, promoted by our Honorable Prime Minister, and also by CCRH. These practices have come to show various and helpful benefits. Also, the integrative medicine, which generally used to tackle this lifestyle disorder, is on the rise, and it basically includes conventional medicine, that is a first-line therapy. Second, with the use of complementary and alternative remedies in the form of Ayurveda and Homeopathy. And third, in the form of practices, good practices, that is yoga practices and physiotherapy. These are the various yogasans or asanas you can prescribe your patient. They should be done in the guidance of a yoga expert. They are various Mandukasan, Savasana, Paschimottanasana, Surya Namaskar, Kapalbhati, Agnisara, Matsyasan, Halasan, Bhujangasan, Dhunasan. These all are the asanas should be done regularly and what should be done under the guidance of any yoga expert. The last is our integrative medicine. That is what we have in the form of therapy, treatment, management, guidance, or any advice. We all integrate them towards the beneficiary of our patients. As we have seen in our cases, we prescribe or organize specific remedies. Along with it, we also advise holistic approach in the form of dietary manifestation, that is whole grain diet and exercise. So you need to follow a good lifestyle. Basically, integrative medicine is a healthcare model that integrates conventional medicine, drugs, surgery, diagnostic with complementary approaches, nutrition, acupuncture, yoga, meditation, herbal medicine, and counseling. It focuses on holistic care, physical, emotional, mental, and spiritual health. Seeks to address root cause of illness and not only symptoms. You can look at the integrative medicine and you can think of our organ of medicine and say that it is focusing on our holistic approach. And it is our idea that they have used now and give us in the new days in the form of integrative medicine. The core principle is the basic evidence-based integration. Therapies which are proven safety should be advised. The therapy should be patient-centered. You can say the patient-centered therapy, not any or any specific treatment. Patient-centered. You have to ask for the patient case taking, and you have to do the case taking of the patient. You have to follow the anamnesis, and then you have to arrive on the medicine. Other is whole person focus. You have to take the interplay of biological, psychological, social, and spiritual factors, and prevention orientates in the form of such as reducing life stress, reducing salt intake, reducing fat intake, and wearing mask, using air filter in your urban areas, and collaboration with the conventional doctors, that is modern medicine, nutritionists, psychologists, complementary practitioner, which all work together for this integrative medicines. Integrative therapy is generally a mind-body practice that is body, soul, and our vital force. Both meditation, yoga, tai chi, mindfulness, complementary therapies, stress management, and resilience training. The benefits are it improves quality of life, support active patient participation, reduces chronic disease, and it's helpful in its management. It reduces reliance on the pharmacological treatment alone because we are integrating now all the other therapies. So here is a summary of my session. What did we learn from this? That lifestyle disorder are the modifiable risk factor. They are on the rise and part of the global burden of disease, which is a cross-sectional study done by Lancet. It has given certain lifestyle factors which causes these disorders. How do we tackle them? By using integrative medicine. What is the role of homeopathic physician in this? One is treating through the constitutional remedies, and if the patient came with the abnormal reports and certain limitation, we have to give organ-specific and adjuvant remedies in the form of mother tincture and local dilution. The homeopathic physician uses a dual approach. It corrects constitutional imbalance, and all this practice should make patient healthy, and it gives a holistic patient-centered management and treatment. Thank you. I finish my session here. If there's any question, you can ask.
Yes.
Ganesh sir.
Yes, Dr. NIPUN Singh Dabi, it's really an excellent session. You really rocked the show with your exemplary knowledge in this Medica as well as how to manage these things. Anyway, it was really a different system. Usually people believe that homeopathy is a system where you will have to stick on to constitutional medicines and all, but frankly, it is not. In advanced pathological cases, we can do this kind of work that is adjacent therapy, just like as you mentioned here. Some of the cases where we will get some exemplary brilliant result when we look into that way. And that's what you have shown in these cases. With all these cases, of course, we need all corrections, such as exercises, even advice for yoga, natural, whatever things that can assist the patient to come back to health in a shortest possible time. And that is what your presentation is all about. And in a way, congratulations being at this younger age, you are able to come up with such a big presentation. That's almost all these lifestyle diseases were covered in your discussion, and what are the miasma, how the miasma affects in this particular each and every case like that. Anything that come under homeopathy can be used for this purpose. And at last, you told about the how to manage those patients who are coming with taking a lot of other systems of medicine. Of course, we can treat with adjacent therapy along with whatever medicine they take from the other school of medicines. So that also is a very good point you mentioned here. Anyway, congratulations. And it is time for discussion. I am inviting your professor, Dr. Vibhu Kumar sir, Pandey sir, to say a few words on this presentation. Can you adjust your camera a little more, guys? Hey, sir. Vibhu sir. Please unmute, sir. Your co-host, you can unmute. Sir has some questions also.
Yes, sir. Actually, I really appreciate the presentation because he has covered almost all.
Yes.
Auxiliary management as well as medicinal treatment as well as conventional approach, everything he has covered. So, I want to make it clear, sir. Suppose there is a hereditary history of lifestyle disorder. Can we control, or manage, or prevent the lifestyle disorder in offspring by prescribing constitutional medicine or anti-miasmatic medicine on the basis of parents?
Yes, sir. We can prescribe generally anti-miasmatic remedies, as I have told you. For example, in the case of diabetes mellitus, it is a hereditary disorder and it is a syphilitic manifestation. So you can prescribe syphilinum in this case. And for the constitutional medicine, you have to take the case of the patient. You may go on phosphorus, you may take lycopodium, or you may give acid phos also in the form of constitutional or repetitive doses. For example, in the case of obesity, I have told you in the NFLD, PCOS, you go for the anti-miasmatic in the form of thuja, medorinum. And for the regular medicine, you may prescribe Apis mellifica, sepia, and certain cystic remedies in the form of such as cystic remedies. You can buy Apis mellifica, Etramior, and pulsatilla. You can also prescribe for that. So, and also second factor you have to think of that the diseases are developing during the periods when you are healthy or you think that you are healthy, and when you go on to diagnosis, it comes in the age of 40 or 50 years. At that time, the diseases are irreversible. Now you cannot reverse diabetes. Now you cannot reverse hypertension. You cannot reverse cirrhosis. You can only manage them. Generally, you can reverse atherosclerosis, but if the patient has gone under a heart attack, so now he is at a risk. He may go on to develop a stroke. So at that factor, you have to take the support of adjuvant remedies. You cannot prescribe high potency, and if you prescribe, you may aggravate the patient condition. So you need to focus on that.
Sir, is there a scope of type 1 diabetes mellitus?
Type 1 diabetes mellitus generally come in the young age, at the age of 13, 14, 20 years age. It is an autoimmune disease in which the total islet beta cell mass is destroyed. We first come with insulitis, and after that, in 7 to 14 days, the disease develops. And you go on toward the insulin-dependent diabetes mellitus. We call it insulin-dependent. Now you have to take insulin. So there is no scope. Generally, you have to take insulin. You may prescribe acid phos, jaborandi, jabolinum for controlling the glucose level. But our role is slightly limited in that disease. We have to take use of insulin.
Sir, in homeopathy, you are not treating the disease, you are treating the patient, right?
Yes.
So, if you consider the patient side as a whole, can we improve the life of the person who is suffering from type 1 diabetes?
Basically, we can improve. We generally have to focus on the dietary management and lifestyle management. Dietary management in the form of whole grain diet. We have to reduce the intake of high glycemic index foods such as banana, certain fruit juices is watermelon, strawberries. We have to reduce high glycemic index foods, potatoes. We have to reduce them. And for dietary manifestation, you have to use a fibrous diet in the form of
Thank you,
bitter
sir.
gourd.
Thank you.
We have to use.
Actually,
Okay,
your
sir.
time is over.
Okay, sir. You can say
Thank you,
vote
sir.
of thanks also, sir.
Uh,
Okay, I am inviting Dr. Ambrose sir to say vote of thanks. Sir, time is already over, sir. That's why we can have some more sessions in the future so that we can have such discussions.
Respected Dr. Nipun Singh Dabi,
Thank you, sir.
congratulations
Sir,
on your excellent presentation at IFPH on managing lifestyle disorder through homeopathic medicine. Truly insightful and inspiring best pieces. And homeopathic medicine lifestyle disorder due to electrical disbalance. Electrical
sir.
disbalance after hormonal disbalance. Hormonal disbalance after stress, anxiety, grief, and mechanical disbalance. So, lifestyle is the very important. Our homeopathic treatment, many lots of medicine describe the. So, very, very thanks. And Dr. Bibu, sir,
Thank you,
very
sir.
thanks, sir. Bibu, sir,
Okay.
pranam. So,
Okay.
behalf of IFPH, whole team, very, very thanks, Dr. Nipun Singh Dhabi.
Okay.
And according to treatment
Okay, sir.
holistic and according to treatment mathematic,
Yes,
king
sir.
of anti-remedies, Thuja, psychotic, Sora, sulfur, and etc. And
sir.
king of
Okay,
anti-remedy, Medonum, Thuja. So very, very thanks. Thank you.
Okay, sir. Thank you, Dr. Ambrose sir, Dr. Vibhu Kumar Pandey sir, and Dr. NIPUN Singh Dabi, and those who attend the English session tonight. And tomorrow we will have a session from Dr. Amit Mittal, and Dr. will be talking about from mind to body emotional conflict and their homeopathic resolution.